what is going on with Instagram face? It's a lifted brow. It's a jawline that is so snatched. It's a high cheekbone. Is this editing or is this plastic surgery?
It's a very interesting question. I get asked it all the time. It's sort of like a culturally ambiguous look, right? And yeah, it's exaggerating certain. It's exaggerated features in a certain way that um, younger people like the way that photographs, and sometimes it's edited. Sometimes there are procedures that we do that can contribute to the the lateral brow elevation, the snatched jawline. That term is also taken off, the snatched look, the snatched neckline. So the procedures we do to get people towards that goal, um, I find that it's an overused term. Um, I find that it's important to make people look their best and enhance their features while maintaining their features as well. Like I always want to maintain somebody's features that make them look their whatever their culture is, whatever their ethnicity is, like maintain those features while enhancing the features to make them look their best. So I'm not trying to make everybody look the same, but there certainly is that term which a lot of people come in and ask for. I want that Instagram face. I want that snatched look. I want to look like Kim and everybody else, all the well-known girls that everybody's trying to look like. So a lot of people come in and ask for exactly that.
So if you were to like break down, if you're looking at these celebrities with these Instagram faces, what do you think they've had done? Like brow lift, jaw lift, nose job?
Oh, it's a very much a mixed bag. A lot of people have pretty close to that anyway. A lot of the famous girls is what a lot of times why they're famous, because they have those particularly strong features that photograph really well, and sometimes we're just tweaking little tiny things just to maximize it. It could be as little as one little pop here and there to maximize it, and other people requires a lot of different procedures to get towards that look. So it's not like it's not a one cookie cutter answer.
And people are doing plastic surgery young now. Like it's not people aren't waiting until they're 60 to get a facelift anymore.
Well, we talked about this last time for a little bit. I mean, younger and younger, right?
Yeah, younger and younger. Yeah, when I first started, I would say the average age of a facelift patient was probably about 60. That was the average, meaning like there were some 50-year-olds and some 70-year-olds averaging out to 60. I'd say today in 2020, the average age is probably 49, 50, which means there's a lot of 40-year-olds, 45-year-olds, as well as 55 and 60. It's definitely gone down probably a good 10 years in average over the last 20 years, I'd say.
I've even heard since moving to LA that I know a couple girls that are 27 years old that have had a lower facelift. Is that normal now?
27 would be quite young.
Okay.
I have done them early on people who've had either significant acne scarring where we had to just pull the skin to like flatten out those divots, and also people with significant weight loss where they really sagged. I've done them on that age range, but for an anti-aging purpose, I would say you're probably looking more like upper 30s on the low end.
Okay.
Yeah.
And what about threads? Threads, kind of talked to you about this before in office. I know you're not the biggest fan. Are you still with that opinion?
It's not that I'm not the biggest fan. Maybe that's accurate, maybe it's not. Let me dive into that a little bit. So again,
what are threads for the ignorant at the table?
So threads are these little, they're like sutures.
Okay.
Really no different than the sutures we use during surgery. And they have these little hooks on them, these little barbs. And they got their motivation from the porcupine quill. If you understand how a porcupine quill works, it's got these unidirectional barbs on it. So when it enters, it can only go deeper. You can't pull it out because as you try to pull it out, those little barbs catch the skin and grip. So that's how these were developed. The particular doctor from North Carolina he used that as his motivation. And so they're these little thin sutures or wires that have hooks on them, and when there are techniques to weave them into the skin, and then because when you try and pull on them they grip, you can't pull them out. You can take advantage of that by pulling in a certain way and letting it grip the skin and then trying to secure it down so it maintains this lift. Wow. These have been around for a long time. But because of the social media boom and the Instagram boom and all these types of things, which, let's face it, usually the younger surgeons are much more, the younger doctors, I don't want to say surgeons, the younger doctors are much more facile at this social media game. And so because it's a sort of a sexy term and a very, it's sort of amenable to social media because you can do it and show a result immediately, it's very much promoted on social media. And so the misnomer here is that people tend to think it's a new thing because now it's being promoted by these young guys. This stuff has been around since 2000. It's been around for 20 years. I've done probably close to 1,000 of them. This is nothing new. There are many treatments that are much newer than this. And so when you ask me what I think about them, I have a huge experience with them. The thing about it is that you need to look at when you're going to do a treatment like this, you need to look at what the effects of it are down the road, right? Like you might do something that looks good today, but if it has somewhat of a negative impact down the road, that's important for that person to understand. And now we've been doing these for 20 years. We understand what the impact is. So you have to weigh out the risk-benefit ratio. And it's just a discussion I have to have with each person. If I know that person's going to have a detrimental effect from it 2-3 years down the road, 5 years down the road, I discuss that with them, and oftentimes these procedures will make the more significant procedure down the road more difficult to perform. So if let's say a 35-year-old comes in and they see a little jowling or a little something that's bothering them, they'll many times ask for threads, and oftentimes after discussions we'll say, okay, let's do that. But if I know they're going to need a facelift at 40 to get what they want, which many people do, or let's say they come in at 40 and they ask for the thread. If I know they're going to need the facelift at 45, oftentimes that procedure will make their facelift results, it will make it more difficult to get the result we want. It might hurt them down the road. So it's a discussion that we have to have. They're not a harmless procedure. Any procedure we do has its implications and its potential downsides. And so it's a discussion that you have to have with each individual person. In general, the threads are marketed by the people who do them as like, you don't need a facelift, you can do threads, and that's just completely false. It's like your grandfather, my grandfather taught us there's no shortcuts, right? In life, there's no shortcuts. There's never a shortcut, and these things are no different. They do not take the place of a facelift. They can give a little bit of a lift if they're done correctly, but usually the results are very short-lived. And so you see them marketed as though, oh, these things last 2 years. That's just, in 20 years, I've never seen a thread lift last 2 years. And I've done more than anyone you see marking them on Instagram, any nurse, any dermatologist. I've done more than that. I guarantee you, I've done more than anyone who's marking them. I've never seen one last 2 years.
What a time to be in your line of work. Because I mean, with social, I mean, like this, it's got to be booming. But what I imagine is somewhat of a challenge for you is, like you said, there's younger and younger people coming in, and I know myself when I was young, I'm not thinking as far ahead as I'm thinking now. Right? You're just like, oh, I'm going to do that. I need it today. I need to look better today, or I need to get that result today. You're not thinking like, hey, this needs to last for 30, 40, 50 years. So do you find difficulty when you're like a young person comes to you and they want this so bad, like, and if you know it's not right for them, like, how do you navigate that?
Yeah, well, that's the whole art of this business. It's learning to navigate that, and that's what takes experience and knowledge and all those types of things, and seeing thousands of them. I mean, that's how we navigate it, because we've been on the other side. We see the other side of it. And with respect to the threads, I've been, there is a role for them, and we've been working on some things to make the scar tissue less and to make the results last with a little more longevity. So there's some things I'm doing that it's making me like them more and more. It's making the results better. And we're fine-tuning these little tweaks that we're making with some other combined technologies. So it's not that I'm not a fan. It's just I know exactly what they do and what they don't do. I know exactly, because I've done so many and seen them for 20 years. What bothers me is the misinformation, the false advertising, let's say. The people saying this is going to last you 18 months, guaranteed. If you find me a patient that's lasted 18 months on, have them call me, because I want to talk. I've never seen that. I want to talk to that person. I've been doing this for a long, long time.
If you can't get a facelift and you just don't want to get threads, is there something in between that can give you insane results that we haven't maybe heard about on social media?
Well, yeah, half my practice are people who are doing these things on. There's all kinds of things. The things that I love to do that give great long results that are completely safe and look amazing. diamond facial sculpting. That's it's one of my favorite things to do. There are some other minimally invasive type of procedures, but there are many things that work very well and hold people off until they need that facelift. Many different techniques.
I mean, we were just talking about me, and I don't mind talking about me because it's me, so we could go. But like, you know, my eyes eventually, my mom like told me my eyes are dropping down, you know,
Yeah.
like at some point, like I have hooded eyes.
Yes.
And I'm squinting and reading a lot, and I imagine over time it's going to get worse. So like trying to navigate with you and just asking you earlier, like what would you do as a 33-year-old man to kind of get ahead of it so that I don't just like my eyelids don't just fall over my face.
Right. And again, each individual, you have to take each person on a case-by-case basis. There's no one right answer. Like we just talked about beforehand, for you, I would try Botox first. I would try we have a little non-surgical brow lift technique that I've created. It combines a little Botox strategically with a little facial sculpting on the upper third of the face, in behind the hairline, underneath the brow. Facial sculpting is my injectable technique, combining Botox in such a way so that we weaken the muscles that pull the brow down and we enhance the muscles that pull the brow up. That's part of the strategy, as well as the facial sculpting in certain areas, just to create that elevation away from the skull of the skin in such a way that it creates an elevation to the brow. That's a very effective technique for many people, completely safe, looks good immediately with no downtime. And so that's a great technique that I would use on you and I would use on me before I considered something more aggressive. Now we try that, we see what it does. I suspect on you it would work great. I have all the confidence in the world it would work great. If it worked great, we do that until such time that you say, you know what, I don't want to see you every 6 months. I love you, but I don't want to see you every 6 months. I get that, right? Like, if that's the case, then we could talk about something a little more aggressive that might last a little longer. That might be, we might talk about a thread lift with some adjunct technologies to make it work a little better. We might talk about a little minimally invasive surgical procedure that will work more predictably well than a thread lift and will last you 10 years versus 6 months. You know, so there's a whole range of things we would talk about depending on your situation.
It's interesting to sit across the table from you and look you in the eye, because and people should listen to the first time you came on the show to talk about how you got into this, because I really think you take an artistic approach to the face, and like I really appreciate that about you. But I can tell when you're looking, like you analyze the face, and it's weird because not everybody, obviously, people don't think about doing that, but this is your line of work. When you look at a face, like just any face, and you start talking about a strategy with your experience, can you in a way almost predict like what will happen over the next 20 years to that face?
Yes, absolutely. And I'm looking at your face right now. I'm seeing under your skin. I'm looking at
I
see the nerves and the blood vessels. Like, I know where all the traps are because I'm doing surgery on those all day. And it's like a little spiel I tell people. This is not to pat myself on the back, but this is just the reality. The reality is, like, I'm a facial plastic surgeon. I built my career, my reputation, my name, and our success based on my facial surgery procedures over 20 years. Facelifts, brow lifts, eyelid rejuvenation. That's how I built my career. Now, based on that success, we developed the non-surgical practice, which we've been blessed and fortunate, and I love that we've developed probably, if not the biggest non-surgical practice in the world, certainly one of them. So now I do tons of non-surgical procedures, which I have grown to love, as well as surgical procedures. So when I look at a person, I'm looking as a surgeon, I'm seeing what's going on inside, underneath, evaluating how that particular anatomy is going to age, and also understanding where the risky components are, because some of the non-surgical treatments, this is not publicized too often, but some of the non-surgical treatments, if not done correctly, can have more significant, drastic complications than surgical complications, because a lot of people who aren't surgeons are doing these non-surgical procedures. There are some really important nerves and blood vessels underneath, and if you stick one of those with a needle the wrong way or inject something into one of those, you could readily cause blindness. It happens all the time. You could cause strokes, which happens. You could cause some really drastic, severe, life-changing complications with a simple little injection if you don't really know what's going on. And so it's just important as a surgeon to understand, as a surgeon myself, I understand those things. And so that's what I'm looking at when I'm looking at your
that's
face.
why I want to bring it up, because if you're working with someone like you can kind of roadmap it and know, okay, like I'm going to, maybe you start 6 months, 2 years, 3 years with the Botox. Then, like, you can roadmap it with someone who knows what they're doing, where like if you're all over the place with someone who doesn't, You know,
Yeah.
I don't want to have to. I would not want to have to come to you to fix something.
Right.
You know what I mean?
Exactly.
It's like getting poor legal work, right?
Right.
Like, doesn't matter if you're saving money in the beginning. I guarantee you with legal work, it's going to cost you a lot more for someone that has to come in and clean it up.
So
Yeah,
what if
that's right.
Stephanie in Minnesota doesn't have access to you and she wants to go to her local plastic surgeon?
Yeah.
What are some things that not only she needs to ask, but let's take it a step further. What kinds of filler and Botox would you look for? And are there some that you would be like, no way?
Yeah, I mean that's so. What products you're actually using is a very personal decision. Some doctors become comfortable with one product, some doctors become comfortable with another. I have mine that I have grown to love over a long track record of using them and knowing exactly how they're going to react. That doesn't mean what I use is the only things that should be used. There might be a doctor in somewhere else who likes a different filler, and they know from their years of experience, they're going to know exactly how that behaves. That's really what it's about. It's about that provider knowing what that product is going to do, understanding the power and the limitations of what it is that they do. That's really what makes, I think, a big part of what makes a successful doctor or provider is really understanding what it is that you're doing, knowing exactly what the power of your procedures are and what the limitations are. So for someone in Minnesota who can't come out here, I think it's essential you find a board-certified facial plastic surgeon or plastic surgeon. That's the only people I would have inject me that I'd be comfortable with, because at least that doctor knows exactly where those important structures are, and they are definitely not going to create any harm. Number one is don't create any harm. So that's number one, board-certified. And again, we've talked about this before. A board-certified facial plastic surgeon, board-certified plastic surgeon, that's a lot different than a board certified cosmetic surgeon. And I'm not going to get into the details of what that is, but there's a big difference. So if you hear the word board certified cosmetic surgeon, that's really not you really want to look for plastic or facial plastic surgeon, not cosmetic surgeon. There is a huge difference, which we could discuss another time. So that's the first qualifications I would look for. And then it's always good to go to somebody who you've seen other good work from. I mean, word of mouth is still, even in this world of social media, word of mouth is still the safest way. When I'm looking for something, I don't go to Google and type in. I ask my friends, hey, who'd you have do your shoulder? You had shoulder, how did it go? Who'd you use? Like, that's still to this day how I find my providers, word of mouth.
That's a great tip. I like word of mouth too.
Yeah.
I feel like some plastic surgeons too, they try to go too overboard. So like if someone's getting their lips filled, they're too big. If someone's getting their cheeks filled, it's squishing the eye up, which makes the eye look small. Like there's all these things that I think people don't realize actually makes them look older. Like if you can't see my teeth, I don't think that's youthful. I want to show my teeth.
Right, exactly.
So there's all these little like secrets too that I think it's important to look for someone that doesn't overfill you like a balloon. Do you have any thoughts on that?
I do. So number one, again, aesthetic judgment. This is a very artistic field. So we have 1 foot in science and 1 foot in art as a plastic surgeon, right? As a facial plastic surgeon, like there's a whole lot of artistry that goes into this and aesthetic judgment. So number one is the provider's aesthetic judgment, right? You need to make sure like they see the face the same way you see it, and that just comes again from word of mouth, seeing their work and talking to that person, that doctor, making sure that you agree with what they want to do for you. So that's number one. Number two, it's back to what I was saying. As a surgeon, right? As a surgeon, I'm never going to try to fit a round peg into a square spot. Never. Because I know I have surgery as an option so I don't have to overfill, right? A lot of popular injectors might be OBGYNs, might be dentists, might be nurses, might be some internists, internal medicine doctors who are doing this on the side. They don't have surgery as an option, so they're going to see you and just know that filler's the only, so they're going to talk you into filler, try to get you to do filler. Fill. Oh, you didn't lift enough, let's fill more. Oh, it didn't do enough, let's fill more. Next thing you know, you got a basketball head, right? Like I never have to do that, because I know if the filling is, if I can't keep it within a natural framework, then I know that that's not your option, and now we have to do a little more aggressive, little surgical pull or something to that effect. So we're never going to overdo it with filler because we don't have to.
Let's talk about something that I don't think has been talked about a lot, and maybe in your profession it has, but I feel like normal people aren't talking about it, and I'm probably going to mispronounce it. Buccal fat?
Buccal fat reduction.
Buccal fat. Okay, tell us about that, because I think that's a secret in Hollywood that people aren't telling anyone.
Okay. So this is no different of a discussion than the thread lift discussion. Buccal fat reduction has been around for 60 years. 60 years probably, okay? Like
I've never
learned,
heard of it. I can't believe it's
right, exactly. That's the point. Again, because it is a fairly sexy Instagram story, right? Because it's kind of quick and easy and can give these contours. Again, these young social media people are showing this as though it's something new. And that's a problem. This is so far from new. It's one of the first procedures I ever learned how to do. It's been around forever. I've done thousands of them over 25 years. This is nothing new. But again, because it's sort of easy to show on Instagram, all of a sudden people are coming in asking about it as though it's new. The new buccal fat, like nothing new about it. The thing about buccal fat reduction is there are a very limited number of people who it is appropriate for. Let me rephrase that. I would say out of 10 people who ask me for it, I'd say out of maybe every month 10 people ask me about it and want to do it. I would tell you, this is without exaggeration, maybe 1 to 2 of those people are actually good candidates for it where it's not going to hurt them.
And just really quickly explain exactly what it is for someone that doesn't know.
So buccal fat reduction is a procedure where we make an incision inside the mouth. We numb you up, kind of like the dentist does, little incisions, little numbing inside the mouth. Then we make a little poke inside the mouth that literally takes 1 stitch on each side to close. But we go into the buccal space and we remove the fat pad that lives there, or a portion of the, not all of it.
Here?
Yeah, it's just outside the mouth on each side.
Here,
so if you suck your cheeks in, that's where it is.
Yeah, suck your cheeks in, you guys, and look in the mirror. That's where it's. That's
where it is. Now, so it takes, a lot of people will put people to sleep. I do it in the office under local anesthesia. It's so easy to do. It literally takes 5 minutes per side. It's like a 10-minute procedure. It's so fast and easy, and it's painless, and it's great on the right person. If you do it on the wrong person, you're going to age that person prematurely, because the biggest misconception people have is that their face is fat, right? That's the biggest. So that's a very common thing. Doc, I have too much fat in my face. The reality is, the face, even when people have round faces, there's often fat is not the reason for it. It's often bone structure, muscle mass, glandular tissue. Many people who think they have excess fat in their face don't. And if you take away fat on somebody where it's really not in excess, you're going to make them age faster, because what's the most common thing that I see as a facial plastic surgeon? On the 45 and up, the most common thing I see is, Doc, my face is aged. I've got gels. I'm hollowed out. My neck skin's getting in. That's all from fat loss. We lose fat as we age. It's no different than our bone mass gets. You hear of osteoporosis all the time. Everyone's bones get thinner. Well, as they age, the facial bones get thinner, but the fat, we lose volume. That's the number one cause of aging, is volume loss. So that happens anyway, and that's going to cause some of your aging. So if you take away a big bulk of fat as a young, you might really rapidly age yourself. So there's certain people who you should never ever do it on based on their facial shape. And again, that's my job to understand who that is, just looking at their face, understanding their anatomy, understanding where their aging pattern is going. Certain people you should never ever do it on. It'd be the biggest mistake of their life. Now, there are a small group of people where, that they are a good candidate for it. When it will not prematurely age them, then that's a great candidate for that procedure, and that's just up to the doctor to really understand who that is.
I'm just going to say this, and I don't know if this is true at all. Bella Hadid is someone that, to me, like when I see her on Instagram, she looks like she had she had like a rounder face, and then she got that like sucked in like model-esque look. So I think she's sort of the trendsetter in that. That's why maybe people are asking you more and more.
Yeah, and look, I can't comment on.
I know you can't comment on anyone.
On Bella. People ask about her all the time. They ask about Kendall. Like, right, there's the usual suspects that people are always asking about, and I just can't comment on them. But again, it's up to me to determine if you're a good candidate for it.
So not everyone's a good candidate for that.
I'd say, again, out of everyone that asks, I'd say 1 to 2 out of 10 people who ask about it, who are interested, are actually a good candidate for it.
What's another trend that you see celebrities and influencers asking you for that's a very niche trend that's new? Yeah,
there's that's new. I think and certain trends come and go. Many of them have been here forever. It's just
more visible
it's more visible now. In the past, in the past, and I've been taking care of a high profile clientele for a long time, but it's only for the first half of my career, they would never even say a word, and no one would ever come onto the website. It was so secretive. But something about social media has changed that. Now some celebrities are really more readily willing to talk about it and make it more visible that they've done these certain things and publicize it. So these trends, we've been doing them for a long time. It's only they're becoming a little more visible now. But a lot of things that people are asking for is that lateral brow, the snatched lateral brow, or the cat eye lateral brow. People ask about that a lot. And again, they're always bringing in pictures of Bella and Kendall and, again, the usual beautiful women. This is what I want. And they have that sort of nicely contoured lateral brow. So that's something that people are asking for readily. They've always asked for it. For 25 years they've asked for it. It's just now it seems to be sort of more visible.
Are there things people are asking for now because of social, because of more visibility, that you just disagree with? You don't like doing certain procedures, like, hey, like, go, that's not necessarily at your practice?
Yeah, so similar to the things we've talked about. Again, Buccal Fat Pad Reduction is way over promoted. A lot of people are having it that shouldn't have it, and they're regretting it, and that's again because they're seeing it every day on all these social media posts, thinking it's new and the latest and greatest, and they're having some overzealous, younger providers who haven't been around to see the downsides of it readily providing it. So that's one thing that I do a lot of, but I don't like that it's being done overzealously and hurting a lot of people. I don't like that. Kybella Injections, we talked about this in the past. That's a similar type of situation. Again, I'd say out of 10, let's make it out of 50 people who ask about Kybella Injections, out of 50, maybe 1 or 2 of them are a good candidate for it. Whereas Buccal Fat, maybe 1 out of 10 are a good candidate for it. With Kybella, maybe 1 out of 50 are a good candidate for it. Similarly, because
you're talking about 2% of people.
Yeah,
wow.
Max.
Yep.
Because, 2 out of 100. Maybe because, again, a lot of people will look at the contour of their neck and say, I don't love the contour of my neck. I want to tighten that up. So there's not one of us in this room who would be, and our listeners may not be able to see who I'm pointing to, but we got 5 people in this room. Not one of us would be a Kybella candidate if we wanted our neck tightened, because none of us have excess fat in the neck. Lay people, and again, non-surgeons, maybe your OB/GYN will look at your neck and be like, oh, let's melt a little fat there and tighten that up, when the reality is there's no excess fat to be had there. And Kybella, you just shoot this stuff in, it melts every fat cell it sees. If you melt fat that doesn't need to be melted, you're going to age that skin quickly. It won't even take a year or 2. You'll see it in a few months. All of a sudden, you've got this crepey, thin chicken skin, and that needs surgery to fix. And I can talk about Kelty Knight. Is it? She publicizes. I think she's
been on the show.
Yeah, she's been. You're right. So Kelty, she publicized it for her show, so I can talk about it. Someone did Kybella when she didn't need it. It made her skin sag and crepey. We had to do surgery to fix it. We did the surgery to fix it on her show. It required a pretty significant procedure to fix. So again, Kybella is something that is just so overdone, and people are just damaging their neck skin by doing it when it's not appropriate. And again, the reason is because your dentist will probably promote it to you. Your OB/GYN will tell you, because it's just an injection. Anybody can do it. Just because anybody can do it doesn't mean it should be done.
So what would you have done on Kelty if she came to you and she said, my neck is not snatched, I don't like how this looks, I can't do Kybella, like you said, what do you do?
I might do facial sculpting to augment the bony structure, which will tighten up the skin. I might combine that with a little strategic Botox, which can lift the neck. I might do a little minimally invasive neck contouring procedure, which can be done under local anesthesia. It's a way of suspending. It's a scarless procedure to suspend the muscles and snatch the neck when fat's not the issue, like on her it wasn't. Then you just need to suspend the muscle. That's all it takes, and you can do that in a very minimally invasive way.
Sign me up for that. What's that? Tammy, you've never told me about that. What is that? What about lip lifts?
Yeah, okay, great question. Very similar to Kybella and Buccal Fat and thread lifts. Lip lifts have been around for 50, 60 years, literally. But you look at Instagram again, it looks like, oh my God, this is the latest and greatest and newest thing. It's the same story, because it's kind of very easily packageable story, right? It's kind of quick, it's kind of sexy, it shows where you can see the results pretty quickly, it's kind of shows some dramatic results. So again, lip lifts have been around forever. I've done thousands. I've probably done more lip lifts than anybody you see promoting them over the years. It's nothing new. It is a great procedure for the right candidate. It's the same story. It's for the right person. For the right person, it's a great procedure. For the not right person, it can create a real unnatural look. And again, how do you know? It just takes your doctor having a lot of experience and understanding of the procedure to determine if you are a good candidate for it.
Bye, Michael. I'm getting a lip lift. Watch the baby.
So do you like, or maybe let me frame this the right way. Are you a fan of what social has done for your line of work, or are you like, there's positives and negatives? Like how do you view it? Because obviously there's so much visibility. There's so many people doing these procedures. You've kind of alluded to some of the maybe inexperienced surgeons are maybe taking advantage, some are not. But like, so how do you feel about the current state of like where this all lives and how it's all seen?
Yeah, I think that there are pluses and minuses for sure. I think that a lot of younger providers are taking advantage of the salacious nature of it, the sexy, quick, dopamine release kind of thing. The easy sell. I think a lot of young providers are taking advantage of that, which I don't like, because a lot of people are easily sold, and then they do it and it wasn't right for them. Now they're going to spend the rest of their lives spending money trying to fix a problem potentially. So I don't like that. I do like when it can highlight the appropriate procedures that really can help people. And so it's a very double-edged sword, and it's a fine line you have to walk when you're promoting these things. But I don't like that aspect of it, but I do like other aspects of it.
You were on like the top hit show on E, which is the first time I saw you. I remember being like 10 years old and watching it. So do you think that it's almost the same kind of thing with social media? Do you see the same inflection of your practice? Like when you were on Dr. 90210, I'm sure you were packed. Is it the same thing now with social media?
That's a good question. Yes, I think so. Yeah, when I was on Dr. 90210, for sure, that brought awareness. And it wasn't because it was Dr. 90210 was one of the first shows. There were a few before it, but we were probably the most widely watched. And the procedures I was doing, these were the highest level procedures at the time. And this level of facial surgery had never been seen on the airwaves or really widely seen before. And so it definitely brought great awareness. It brought a ton of people, not just to me, to facial specialists all over the country. I'd get emails every day that, hey, thanks so much for what you're doing. My practice has boomed. Like, that brought great awareness to people about how natural these procedures could be. And so I think it helped the industry as a whole. Social media, we promote the things that I believe in a very honest way I like to think with the highest level of integrity. And I think people do respond to what we show, and it's definitely helpful. It is the way of the world for to promote every business now, I think, is social media. So it's definitely a positive thing for us. So I don't know if it's the same as Dr. Natuno's, because that was like an instant automatic, again, not just for me, but like I think it just brought immediate awareness to people who never really understood what facial surgery or plastic surgery was. I don't think social media has quite the same impact as this TV show did, but it definitely has a positive impact to bring awareness to people.
Are you a fan of, and maybe this is a two-part question, taking fat from your ass and putting it in your lips, or doing like a Lisa Rinna moment and putting silicone in the lips? That's
a good question too. I spent the first 2 years of my career doing liquid silicone injections. I studied, just a quick thing, I went around the world basically and learned from the best of the best. So if I wanted to learn noses, I studied with the best rhinoplasty surgeons. When I wanted to learn facial implants, I studied with the guys who created facial implants. When I wanted to learn facelifts, so I just went around and found the best of the best. Well, I wanted to learn silicone injections because I had heard from some people they're great and they're permanent, and when done right, they're amazing. So I sought out one of the biggest silicone injectors in the world, and I spent almost 2 years studying with him and learning from time to time. So I was one of few doctors who was actually injecting liquid silicone. And I stopped doing it after several years because I saw some complications, not from my patients. I saw complications from the guy I was learning from his patients who had it 10, 15 years before. What I learned was that silicone can rear its ugly head years later. You could have a great result for 10 years, 15 years, and all of a sudden out of nowhere, boom, you could get this like big mass that gets infected and can become a chronic problem that requires surgery to fix. So after I saw these complications from people that had it done years before I even started practice, I just stopped cold turkey. I said, I'm not willing to put people at risk like this, so I don't do that anymore. There are probably very few doctors who are injecting that these days, although I still see some people who had it done in their basement from some filler party. Some doctor came in from Brazil and injected people. I mean, you hear about this stuff, but it's not a mainstream thing to do.
That's what I think. I think this was what happened to Lisa. She got the silicone in her lips, and then years later, exactly what you said, there was a problem, and I think she got them removed and replaced. Her lips look so good. So fat from the ass, do you like that in the mouth?
Fat injections is, again, it's a time-tested procedure. It's been around for 50 years, probably. Again, I mean, you may think this is like a new thing looking at some young guys' social media, but it's been around for 50 years. Great procedure. If I'm just doing somebody's lip, if that's all they want, I would do other things before I did fat, because to do fat, you have to liposuction it out. To liposuction it out, you have to sometimes put people asleep or give them sedatives. It becomes a procedure. It becomes a day-long procedure with healing. Meaning they have the procedure, they have to go home and rest, and then they have to recover from the liposuction component. So if I'm just doing lips, I might use some other things. There are lip implants. Well, first of all, there's the fillers, which of course work well, but they can be as short-lived as a few months. There are lip lifts for the right candidates, but there are lip implants which work beautifully well, and they're totally safe, and they're not very widely known. And because it's such a little Instagrammable thing, I'm surprised you don't see these young guys promoting that, but they're very hard to do right. So maybe these guys haven't figured it out yet, but as soon as one of these guys, I'm sure they're going to start promoting as though it's something new. Lip implants have been around for a long time. There are a newer version which are great. I will admit it's a newer version that are great, and I do love doing them. So it takes 10 minutes to do. So if you said to me, I want something permanent in my lip, I've done filler with you 10 times and I just don't want to come in anymore, I'd probably go to a lip implant first if that's all we're doing. Now, if you're already going to be asleep for something else and we're already there, then I'd put some fat in and see how that goes. And oftentimes fat will be permanent, but just as often it will go away within a period of time, whether that be 6 months or a year or 5 years. It's hard. It's unpredictable to know. It's unpredictable with its longevity. But if you're already asleep, we'll do fat grafting readily. But if you just come to the office, I would just numb you up and recommend a little lip implant, which takes 5 minutes to do and will last you forever.
And do you just so I'm clear, you don't do anything body, you just do face, right?
Yeah, we have every non-surgical body tightener on the market. So we do the non-surgical body tighteners, but as far as surgical procedures, just face.
Okay, and I've done something at your office, PRP, where you guys took my blood.
Yeah.
Remember, Tammy, I almost fainted in the office. You guys took my blood. It took 15 times to get my vein because you can't see my veins. I was so scared, but the results were amazing. Out of every procedure I've ever done, microneedling and PRP are the best. And I know Kourtney Kardashian, she posted on her Instagram, is a huge fan. Can you speak on that?
Yeah, so really it's the Instafacial. It's not just if you remember, it's not just the blood and the needling. It's injecting the blood in a strategic way as well as lasering it in a strategic way. It's really a 4, sometimes 5-part treatment, but in combination with the other technologies, using that, it can be the best thing you can do for your skin, both for texture, tone, prevent anti-aging, improving elasticity. It's just an amazing treatment that I really love. And over the years, I've just figured out ways to make it better and better. We keep advancing the way we're doing it, and the results are just great. I love the procedure.
I would actually send you to do that. I think that
I need to come.
Don't
in
you
for
think
a full,
PRP would be good for him, Dr. Diamond?
Yeah. Well, yeah. So just for your let me see for a sec.
You can say it on air.
It would be great. Yeah. You'd get a great result from it for just the little browns and reds and some of those little just those little, just for the texture and the tone to smooth out the tone of your skin. It
The
would be amazing.
capillaries. He has little. Yeah, I think that
No,
you should
listen,
do.
I need a full like diagnostic. I need to
Yeah.
get. I need to get
Scott
in there.
Disick posts on it too. A lot of guys
Yeah.
get it done too.
Yeah.
It's not just for women. The PRP
Yeah.
is one that I would send you to do.
Listen, a couple more months of quarantine, and I'll be fully falling apart. So
Speaking of quarantine, a lot of people are getting plastic surgery in quarantine. Am I right?
You are right. Yes. I've been since we've been back open. We shut down during the shutdown, but as soon as we were allowed to go, we had
Flooded.
50 people who wanted surgery. I've done every Saturday and Sunday since we've been open. More? I don't know. I can't keep. I don't know anything.
A lot.
Yeah,
lot.
maybe more than that. I mean, it's been a
Tammy,
lot.
slide me an appointment in there. Don't,
It's-
Yeah, it's been a lot of surgery since we've been open every Saturday and Sunday. I mean, I haven't had a Saturday or Sunday off since it's been 2 months now. Yeah.
Oh my
Yeah,
god.
yeah.
Well, it makes sense. Like when you explain it, we were talking off air. Like everyone's hiding out, nobody's seeing anybody. Like what better time?
Yeah, and people are working from home, and people are readily wearing masks, so they could, if they had a bruise or something, they could just hide it. No one asks any questions. It's like the ideal time.
Oh my god.
Yeah, and a lot of actors and actresses are still shut down, right? They're still not. So a lot of them, this is their ideal time.
Speaking of masks, because I know we're running up on time, I watch your Instagram and I like what you post, and I wanted you to talk about the mask and how to properly
And gloves.
because we're all nobody knows what we're doing.
We're
Nobody
gonna
knows what's
sit
going
back
on.
and just let you spiel
But-
what the mask
But
and
as a
glove
surgeon
situation.
who you have to wear a mask and you have to keep a sterile
Yeah.
environment. Like, I drive around in the streets. Lauryn and I were driving home from San Diego the other day, and you look at the people wearing masks, everyone's touching, everyone's
Yeah.
spitting, they're on the phone. And I'm like, maybe just not having it's better than
Taylor,
what
our
going on.
producer, is touching too many things without using hand sanitizer.
Well, because they're touching the things and then they're touching, and I'm like, listen, maybe the mask is actually becoming a liability. I'm compliant. I'm going to do whatever. people are
Taylor's
saying.
taking notes back there, so give
Yeah.
give
But
us
I
the
just want you
spiel.
to talk about it because I know you posted. People should go watch it, but here's a good place.
Yeah, as a surgeon, like my whole life is sterile fields, and I mean it's our whole, when we do surgery, you're keeping a sterile field. You're maximizing the sterility and managing contamination. So we're the foremost experts in this. Okay. So I never really thought about it much because we shut down. I was in quarantine. I hadn't gone out in probably literally 4 or 5 weeks. I hadn't gone out, and finally I said, you know what? I just need to get out. I was like, I won't mention the name of the place, but I have my favorite sub shop, my favorite sandwich shop that is a 30 or 40 minute drive from me. But it reminds me of home on the East Coast. It's one of the only, I don't want to give away too much because I don't want to get them in trouble, but it's
I'm going to make you tell me about it.
it's sort of an authentic
I'm not going to
kind
let
of,
you out of the office unless you tell me. We can do it after, but
okay, well, it's sort of an authentic kind of place. So it just reminds me of home. So I love to go, but it's an event for me to go because it's a far drive from my home, and when you get there, there's an hour wait. So it's like a 40-minute drive plus an hour wait every time I go. I go on special occasions. I make my kids go on my birthday and Father's Day because they hate to go, but I love to go. So I was like, I got to just go get one of these sandwiches. And so I went to this place. I called ahead. They said, yeah, there's going to be social distancing and all this stuff. I said, fine. So I got there, and as the guy's making my sub, I'm watching him. He had a bandana on. I think it was a bandana on. And he's making the sub, and then the bandana fell below his mouth. So he takes his hand, puts the mask up, back over his nose, and then continues to make my sub with the same gloves that he was wearing. 2 minutes later, the mask falls down. He stops putting the tomatoes on and takes his hand and puts the mask back up, and then goes back to putting the mustard on, and then saying, and I'm sitting there going, holy shit. Like, I don't know if I can say shit, but
You can say shit.
I'm like, I can't believe what I'm seeing. Like, this guy, it would have been much better had he not had a mask on. He was completely contaminating my sandwich. It was so the technique he was using, it was just so incorrect usage of a mask. It would have been much better had he not had a mask on. And then I'm looking around, and there were 10 sandwich makers, and they were all doing the same thing.
We don't have the sterile training. We don't know.
That's right. So I'm sitting there thinking, this place is allowed to be open, but my office has to be shut down. I'm like, this is ridiculous. Like this guy is going to contaminate 100 people if he's got this virus. So then it dawned upon me. I start looking around, start paying attention. It's commonplace for people to be grabbing their mask and putting it back up. That's complete contamination city. Similarly with gloves, I see people with their gloves, and then they're touching things, and they're touching their mouth. So it dawned upon me that people have no idea how to use gloves or a mask, and you're better off not using them if you don't know how to use them. So what you have to understand is if you touch something that's contaminated with the virus and it gets on your glove, now your glove hand is contaminated. So you have to treat that as though you have virus on your hand. So whatever you've touched with your glove is now contaminated. So just because you're wearing a glove and you touch the faucet on your sink, well, now that sink is just as readily contaminated. So just because you're wearing a glove doesn't protect you from anything. And so you need to think in that way. You need to just assume you've got the virus on your hands if you're wearing gloves, and just know that anything you touch is going to be contaminated. So you still can't touch your face with your gloves on. You shouldn't touch your faucet with your gloves on. You shouldn't touch a pen that somebody else is going to use with your gloves on. You need to so you just need to think in advance, like playing chess. You need to think steps ahead, and it does take a lot of concentration, and it takes a lot of understanding to think this way. And so similarly with the mask, you can imagine if you were in contact with somebody who's got the virus and the particles get on the outside of the mask, well, now if you touch your mask with your hand, now you've got it on your hand. Now anything your hand touches is going to be contaminated. So when this guy's sitting there making my sub, if he's got virus on the mask, and the whole reason to wear the mask is to catch virus from getting into your mouth, so let's assume he's got virus on his mask. Now he touches mask. Now he goes back to making my sub. Now it's on the tomatoes. Now the mask falls. He goes and takes his hand, puts it back up. Now he's putting on the mustard. Now it's on the mustard bottle that 10 other guys are going to touch. Now he's puts the mask back up because it fell off his nose. Now he goes to cut the sub with the knife. Now it's on the knife. Like, it's a disaster.
How do you live? Do you just like look at this and then and then you're also looking at his face and you're like, he could use a little filler in his temple. I mean, it's like so like stressful.
I love this country and I love the people in this country, but I have about 0% faith that any of them can wear this mask.
Did you
properly.
eat the sandwich?
I did not eat the sandwich. No, I didn't eat the sandwich. I went all the way down there. I did not. I couldn't. I wanted to throw up just watching it. It was so gross.
That's what compelled you to do the video.
That's what compelled me to do the video. That's what made me want to do the video. And I think there should be some PSAs about this stuff because I don't think people still understand. And that's probably, look, again, we could talk about what the realities of this virus are, but that's a whole other discussion. But I think that if people really knew how to use their gloves and mask, you probably would decrease the transmission rate quite significantly, I would bet. I don't know what the statistics are on that, but I know what I see. And I know that guy, if he had it, he contaminated every single person he saw that day. And there were probably 100 people who went through there, I would imagine, throughout the day, if not more. So that's just what I have to say about
I wish
that.
our officials would talk more about stuff like that and would talk more about boosting immunity and about staying healthy besides just saying like masks and social, because I think like there's so many people, we get the benefit of sitting with people like yourself and learning. Like we get to sit with experts and doctors all the time and get the information put here, and people that listen hopefully get that information as well. But the high majority of people in this country, they're just watching mainstream media. Like nobody's talking about this stuff. It's like wear a mask, socially distance, don't worry about your immunity, go to the hospital if something happens. Like, well, what do I do? Like right now, my mom was asking like what should I'm like, you get your vitamins in, get your vitamin D, your A, your E, like boost your immunity to fight it so that you have a fighting chance if you do get it, because it doesn't look like it's going anywhere anytime soon.
I agree with you 100%. I agree with you 100%. Staying, by the way, keeping people in, again, we'll get political here, I guess. I don't really want to, but keeping people inside is the stupidest thing I ever heard. You need sunlight. You need with sunscreen protection, of course, but you need that vitamin D conversion for your mental well-being, your overall health, which is going to help fight if you get infected. If you're the healthiest you can be, you're going to be able to fight it off much more readily. So to keep people inside is the dumbest thing I've ever heard.
I don't mind being political. This solution is going to create more problems than the original problem.
Oh, for sure. People need to be outside. They need to be exercising. They need their fresh air. They need to. Now, you need to do it safely and smartly, but you need to be outside. I agree. You need to keep your health maximized. Vitamins, eating healthy, working out. You need to do all these things. And as you have seen, the people you know who are healthy, who've gotten it, it's less than a cold. It's less than a cold. It's the people who aren't healthy in general. Of course, there are the outliers. But 99.9% of people who are really healthy, it's less than it's like a cold.
Yeah, like I look at like, this is not so political. It's just if you're looking at stats, and we're just looking at statistics, like the people like you've mentioned that have been taking care of themselves are healthy and don't have the they typically it's minor to little issue.
That's correct.
The ones that are having problems or maybe pre-existing conditions or are not taking care of themselves, and like that's a problem. And we should be talking more about how to boost your immunity.
So-
and how to
I
take care of.
agree with you 100%. We don't hear anything about that. We don't hear PSAs on the right way to use the protective gear, and we don't hear about how to maximize keep yourself
And it's
the
been
healthiest.
politicized too much. Like, this is a health issue. It's not a political issue. Like,
Correct.
This is it's like that's what drives me nuts about this. It shouldn't be a left right political thing. Like, it should be like, this is a health issue. This is how you
Correct.
take care of this health issue.
I agree with you 100%.
So to round out this conversation, if you were to leave our audience with one tip to boost their immunity, it could be a quick tip. What is it?
If I had to give you one tip, I mean, there's many. The bullet points: exercise, eat healthy, and get sunlight with sunscreen. But you need sunlight to stay inside. Sunlight is essential. People don't talk about it for vitamin D conversion, and vitamin D, that's how your body converts vitamin D into an active form. Vitamin D has been shown to be essential for immune purposes as well as mental well-being. You need both of those things to be strong. So to keep people inside is probably the dumbest thing I've ever heard. And I would say the one thing I would say, get your ass outside. Get outside.
I love it. Dr. Jason Diamond, where can everyone find you?
We're in Beverly Hills. What's our Instagram? I don't even know. Our Instagram at Dr. Jason Diamond. Is that right? Dr. Jason Diamond.
At Dr. Jason Diamond. He has the best Instagram.
Go
you
watch
guys.
the mask video. People, learn how to wear a
Yeah.
mask.
Thank you for coming on the podcast. We will leave in the show notes where his other episode was, and come back anytime to talk plastic surgery.
You always kill it on these
Yeah.
shows.
All right. Thanks so much.